Welcome to Optimal Anesthesia Insights, the podcast where we unpack the trickiest challenges in the OR. Today, we're diving into diastolic dysfunction, DD for short. What is it and why should anesthesiologists care? Let's break it down with some slick insights. Hey, what's the deal with DD?
Hey there! Diastolic dysfunction is when the heart turns into a grumpy water pump. It squeezes out fine but hates refilling. The left ventricle gets stiff during diastole, even with an ejection fraction over 50%. It's a diva that rejects preload, and it's got grades. Grade 1's mildly slow, Grade 2 ups the pressure, Grade 3's brick stiff, and Grade 4's the irreversible grump. For you anesthesiologists, it's a stealthy curveball that demands smooth moves to keep surgery from going off the rails.
Love that pump analogy. So why is this a hot topic in the OR?
Surgery's like a rave for the heart. Fluid swings, stress spikes, and anesthetics can make this diva lose it. Push too hard, especially with higher grades, and you clog the lung pipes with pulmonary edema or spark a heart failure tantrum. It hides behind a normal EF, so you've got to be on your toes to catch it.
Sneaky indeed. What's breaking down inside the heart?
Picture a gym gone wild. Calcium's the trainer yelling for contraction, but the cleanup crew, circa 2A, is slacking, leaving calcium trash that drags relaxation. Titan, the stretchy spring, rusts stiff from age or sugar gunk. Fibroblasts dump fibrous junk, turning the heart into a balloon that won't budge. Pressure spikes, lungs flood. It's a mess in there.
Wow, chaos at the cellular level. What's causing all this?
Think of it as an old car taking hits. High blood pressure bulks the engine, aging stiffens the frame, diabetes gums it with sticky crud, and obesity overloads the trunk. Atrial fibrillation skips the turbo kick, and bam, rust and dents jam the whole system.
Rusty cars and stiff hearts? Perfect. How do we tackle this pre-op, intra-op, and post-op?
Let's roll through it like a pit crew. Pre-op. Prep's key. Fuel. Preload needs balance. Peak with echo to avoid dry or flooded tanks. Tune RPMs to 60 to 80 with beta blockers or diltiazem. Smooth exhaust pressure with nitro if it's spiking. Gauge the grade with BNP and echo vibes like EE prime. Intra-up. Mid-race, keep it steady. Start with stable juice. Etomidate or ketamine, dodging propofol's wild dips. Cruise with sevoflurane. Tweak fluids in tiny bursts using stroke volume cues. If it sputters, phenylephrine your quick fix. Lifts without revving. Post-op. Cool down's clutch. Pain's a tachycardic gremlin. Zap it with blocks or smart combos. Skip NSAIDs if kidneys wobble. Watch lungs for flooding with oxygen and BNP checks. Keep beta blockers humming and get 'em moving to dodge fluid jams.
That's a tight playbook. What's the prognosis look like?
Depends on your finesse. Grade 1's a jogger, manageable with care. Grade 4 is a stubborn mule, tougher, riskier. Nail the fluid rate pressure juggle and it outruns systolic flops. Fumble, and you're stuck with drowned lungs, wonky rhythms, or a long hospital pit stop. It's all about precision.
Awesome breakdown. Let's wrap with a takeaway for our anesthesia residents out there.
Residents, listen up. DD's a sneaky beast. Know its grades, master the preload dance, and keep heart rate and pressure locked in. You're the ringmasters in this circus. Juggle those balls right, and your patient cruises through. Sloppy hands mean a messy show, so stay sharp and own the OR.
Boom! That's gold for the next gen of anesthesiologists. Thanks, Grok, for dropping the knowledge. Catch us next time on Optimal Anesthesia Insights for more game-changing tips. Stay tuned, stay slick.